Well, you've made it. You've achieved the goal of entering the nursing program and you're taking your first class. You may be feeling anxious or nervous or excited or afraid. These are all normal emotions during this time. You're going to be absorbing a lot of new information over the first week and it can be overwhelming. What you're feeling is okay. My name is Dr. Lewis and I'm the Terry Campus Student Success Coordinator. And I am here to offer you some tips on how to succeed in nursing school while also maintaining a sense of well-being. The purpose of this presentation is to provide you with some basic tools to help you as you begin to experience all that is a nursing fundamentals class. In this presentation, I will talk about very practical things that will help you as you experience the new reality of nursing classes. Nursing education is a unique and challenging experience. Many people can have some culture shock when they experience their first nursing class. Nursing schools ask students to not only learn and integrate new information, but also practice and learn new skills and apply all of this while caring for real patients out in the healthcare environments. During your fundamentals class, you will have days dedicated to all of these elements of nursing education, and it is normal to feel overwhelmed by all that you're expected to learn and master over the course of your nursing fundamentals class. Before we get started, let's take a moment and reflect. What is your biggest fear as you begin this journey? By identifying and naming your fears, you're taking steps to address them. Hopefully, as we move through this presentation, you can identify some resources that can help you address these fears. So why is nursing school different from other experiences? You'll be learning a large amount of information in a very short period of time. Most classes beyond the fundamentals courses are only 7 weeks long, so it's not unusual to feel overwhelmed by information. You're expected to not only attend class, but you will also have to balance your time between class, lab, and clinical, let alone managing the details of your life outside of school. Since you're entering a profession where you will be responsible for a person's life, the expectations are high for you, which creates pressure. You will be learning to think like a nurse. You'll hear terms like critical thinking or clinical judgment, and they represent you're using your higher reasoning skills to apply your knowledge to specific patient care scenarios. First, since time is such a big issue in nursing school, let's talk about the things you can do to help manage and master the time commitment to nursing school. The first thing that you should do is find the weekly schedule or your syllabus for any of your courses in D2L that you're taking this semester, so that you have all of the information in order to set up a weekly schedule. Now, I'm a huge fan of planners, whether they're digital or on paper. Planners are the key to me understanding how to manage my workload on a day-to-day and a week-to-week basis. I would encourage you to find a planner and use it to help navigate your commitments. The few minutes that it takes to set up your planner will pay off as you begin to look ahead from week to week and know your weekly schedule. You can use digital tools like Google Calendar, Outlook Calendar, or you can even Google search for nursing student planners if you want to combine planning with useful study tools. Time blocking might be helpful as well if you feel like you cannot find time to devote to study and learning. You can use a blank piece of paper or go back to the planners that I mentioned previously. Using your course, lab, and clinical schedule, you can block out that time and then begin to block things around that time, like study time, if you have work time, meal prep time, time with children, etc. It has been my experience that assuming that you will just find the time does not usually result in your actually finding the time and having an effective use of your time. So it behooves you to make sure you set aside time to do the things that need to be done to help successful in nursing school. If you find yourself overwhelmed with tasks and need assistance in how to prioritize what needs attention, there are a variety of methods you can use to help you visualize this. There's something called the Eisenhower method, and another way is something I like to call a brain dump. I simply sit down with a blank piece of paper and I list out all of the things that are on my mind. Sometimes I'll have a column for work and I'll have a column for home and I'll list everything out. And the next thing that I do is I figure out which are the top 3 things that I need to address. and I put them to the one side, or I notate them somehow. Then I pick out the easy three, which are the easiest things that I can do in this list that are not going to take as much effort. And then the last thing I do is pick out the next three. So by doing that, I've actually prioritized what things need my attention, what things can get done quickly, and after those initial things are done, what needs to happen next. So that's one way to manage all the things that are flying around in your head and all the tasks that you have to get accomplished. So what can you do to succeed during class time? Well, there's a lot of things, and they're pretty straightforward. The first one, and it's exactly what you would think, prepare for class. Okay. Most classes have reading assignments and or videos posted to help you prepare for class. It is the expectation of all of our faculty that students have reviewed the material before coming to class. If you find that you're not able to understand the book, go find other resources. There is YouTube that you can go in and you can type in hypertension, nursing, and you will probably find a video done to help you visually understand what you're trying to learn. My next tip is to come to class. And this sounds like it should be straightforward, but you'd be surprised how many students don't come to class. When you're in class, the faculty are telling you what's most important to focus on. They can help clarify things. They can help you understand what are the key points to any particular concept. So coming to class is always going to benefit you in terms of mastering the information you need to master. The next tip is to ask questions. Now, everybody has different levels of comfort with talking to their instructors, but we don't know if you have questions if you don't ask them. So please know that there are no dumb questions. Please ask. If you're not comfortable during class time, come up after class and just ask your instructor any questions that you have. You can write them down during class and come up later and just kind of present them with the list and they will go over them with them. My next step is to learn how to organize your class content. So in other words, you should learn how to put your content in a way that you understand it. Okay, if it could be doing concept maps, it could be using some of the ATI active learning templates, which I have an example posted on this slide. Okay, but learn how to organize the class content so that when you go back to look at it again, it makes sense to you. My next contribution towards being successful in the classroom is to get off your phone or put it away. I, of all people, understand the attraction and the magnetic force that surrounds my phone and keeps dragging my attention to it. But I guarantee you there's nothing on there on social media, on your friend's text, that is going to be as important as whatever you're learning in class. It's very distracting to you. It's also distracting to your faculty and to your fellow students. So unless you're using your phone for some sort of audience response system like Kahoot, my suggestion would be to get off your phone and even put it away so that you don't see it and you don't get distracted by it. Use all of the resources that are available to help you in the classroom. The faculty are your biggest resource. They are there for you. They know the content. They're the ones teaching it. So use them as a resource. Secondly, ATI. ATI is a resource that is going to follow you through nursing school and can actually stick with you beyond where you're getting ready to take your NCLEX. Finally, you can come to me as a student success instructor if you need more resources or you need to go over things and you're not comfortable speaking with your faculty member. When I see students in my role as student success coordinator, I will often hear students say, I study all the time, when they're lamenting that they're not achieving the level of academic success that they want. So I have to ask them, how do they study? And I will often hear that they read their PowerPoint notes, if they have any from class. I want to talk about why this strategy may not be the best way to study and actually retain the information that you're covering. Reading is a very passive way to engage with the material, and it's been shown that the more actively someone engages with the material, the better that you're going to remember it and understand the material. Think about it. You read all about a procedure like taking a blood pressure. You may read about where to best place the blood pressure cuff and the stethoscope, and you may know what a normal blood pressure reading should be. Compare this to the experience of actually taking a blood pressure. By actively engaging in the procedure, you're more likely to remember how best to complete each step of the task and what that blood pressure sounds like. My take-home message is the more actively you can engage in your class material, the more likely you will be able to retain that information. Ways to actively engage in class content is to use concept mapping, color coding your notes, recording lectures so you can go back and listen to them and enhance your notes at times. Also engaging in activities that help you apply to the knowledge, like questions. ATI offers many resources you can use to actively engage with your learning and help to retain it. Another large part of your academic success is to learn what your learning style is. For example, I am a very visual learner, as many of you probably are. So I learn best by seeing a concept diagrammed. I learned very early in nursing school that I had to take my written notes that were words and diagram it out so that I could understand the processes behind it. If you know your learning style, you can tailor your study sessions to include how you best learn. If you don't know your learning style, my suggestion would be to go to Google and just ask Google, what's my learning style? There are so many different surveys out there that can help you to learn what your learning style is. Once you know that, it may help you to better engage with the content so that when it comes to time to take an exam, you feel much more confident in that exam. Part of your nursing school journey involves learning and practicing nursing skills in a skills lab. All of you will have to demonstrate competency in the assigned skills at various points through the semester and beyond. Think of it this way. The skills lab is a place where you can do all of your learning and make mistakes in a safe environment. While it's completely normal to feel anxious about having to be evaluated on how you perform skills, there are ways to help you ensure that you're successful in the skills lab. My first suggestion is to practice, practice, practice. There is a reason why I've had to recertify in BLS CPR every 2 years since nursing school. This is because repetition helps a skill to become second nature. The more that you practice, the better you will perform that skill when you're in front of an audience. Try not to let the anxiety control you. Accept it, as it is completely normal, but it does not have to be everything about the experience. Sometimes even admitting, hey, I'm a little anxious about this, will help the anxiety to dissipate a little bit. Almost as like if you recognize it, it goes away a little bit. And the third point for success is to keep your assigned appointments. Lab time is important, and not showing up for sign-off appointments can be considered a failure for your first attempt. If you're having trouble attending an appointment due to a personal issue, please contact the Skills Lab coordinator, Mrs. Golden, and let her know so that she can make arrangements and you don't get penalized for missing that time. Let's talk a little bit about clinical, because that's another part of your nursing school journey, and it can be so rewarding as you're able to apply and see in real life the things that you're learning in the classroom out in the real world. The better you prepare for your clinical day, the more smoothly that day will begin for you. The night or the day before your clinical time, ensure you have all the paperwork and tools in your clinical bag or backpack, or whatever it is you're bringing to clinical. Be sure that you're familiar with how to do the paperwork and write down any additional questions to ask your instructor when you get there. Make sure your uniform is clean and prepared for the day. I personally like to hang everything I'm going to wear the next day up so that when I'm trying to get ready very early in the morning, I will not miss anything. I also have all of my tools in a basket, and I add all of them to my pockets before I leave the bedroom so that I am prepared when I come to clinical. Aim to be early to clinical. Make sure that you know how long it will take to get to the site, where to park, and how long it will take to get to where you're meeting your clinical group and your instructor. Now, you may find that you love your clinical instructor, or you may find that your personalities do not mesh well. It's the expectation that you will remain professional during your clinical day. Please be open to communicating with your clinical instructor. They are there to help you learn. Don't be afraid to ask questions and help clarify your thinking. If you observe any changes at all to your patient status, please report it to both your clinical instructor and the staff nurse. I'm a big fan of journaling every day, and we will ask you to journal as part of your clinical journey here at Delaware Tech. As part of the clinical requirements, you do have reflective journals to complete, but I think they have value in helping you process the events and feelings of the day as you look back on the day and identify what you think went well and what you could improve upon. I want to take a moment and talk about self-care and mental health. As future nurses, you are entering in a profession where you'll be providing care for other people and helping other people. What I want you to hear right now is how important it is to also care for yourself. Some of these suggestions might feel impossible at this point, but there is merit and experience behind what I'm suggesting here. Burnout is very common among caregivers and it happens to all of us, even educators. Here's what I want to tell you. Do not feel alone. It's happened to me many times during my career. It's a sign to you that you are due for some self-care. In my experience, all of the burnout I have felt has been temporary, generally resolving after I've spent some time engaging in activities that bring me joy. Be kind to yourself. This is a big journey. Your brain is experiencing so many new things every day. I would suggest to find the individuals around you that can serve as support systems. This may take the form of a study group, peer mentors in upper classes, school counseling services, or even engaging with others in a professional organization for you, the Student Nursing Association. You'll be able to spend time with other students who have lived through what you're experiencing now and who can provide you with support and encouragement as you go through it. I would encourage you to block out time for daily wellness practice, and I find that this oftentimes becomes a low priority when you're in something busy like nursing school, but it is worth it. Whatever form that works best for you. So what I'm listing here may or may not be what works for best for you. Personally, I've found a great deal of inner peace in engaging in a 5-minute daily meditation. I go to YouTube, I type in 5-minute meditation, I shut my eyes, I go someplace quiet, and I just let my brain kind of reset. It helps me a lot to be able to focus as I move forward. Journaling for me has served as a place where I'm able to name my thoughts and concerns as well as process my emotions. It's a place where it's kind of safe for me to let out whatever is inside of me so that I'm better able to deal with whatever's coming next. Regular physical activity could be something as simple as taking a walk outside for a few minutes. If you're able, try and block out some time for sleep. Ideally 7 to 8 hours. And finally, don't underestimate the power that water can have in help maintaining your energy levels and keeping you healthy. In addition, I put real food on this list. In other words, junk food is great. It will feed your soul. However, it's not going to provide you with the long-term energy that you might need to make it through a grueling semester. So, indulge when you need to, but remember you need to follow that up with some good protein, carbs, and fats to make sure that you're providing your body with the fuel that you need. Let's talk about leveraging your resources. So our campus does offer different resources. We've got tutoring centers and the Skills Lab to offer free support for you if you're struggling. If you go to the college website and you go to resources and click down to students in need, there's a variety of resources there that may be helpful for you. Mental health resources, financial resources, and other resources. So please remember that there are resources available to you outside of the nursing department. Your faculty are your biggest resources. We have clinical experience, we have wisdom beyond textbooks. Okay, we offer tutoring sessions, and my suggestion is to request tutoring sessions from your faculty and then attend them. You can get a lot of things clarified. Now, what you don't want to do is come to the tutoring session and say, "Tell me what's on the exam." You're not likely to get the answers that you want, and it's probably not going to be satisfying. However, you could say, "Hey, can you go over concept X one more, just to help make sure I have it clear in my head?" So by all means, use your faculty as a resource. Use review guides and question banks to reinforce learning. And it says to use ethically, meaning that we know as faculty there's a lot of resources out there that were placed there by former students, and they may or may not be accurate. Okay, and you have to be careful because if you're using something, it could be considered academic dishonesty. So please make sure that whatever review guides and question banks you're using, ATI is a great source for question banks. That is an ethical source that's not going to get in trouble and put you in shark-infested waters. Other resources, YouTube I've found is almost like never-ending font of resources for learning. So Khan Academy, Osmosis, okay, there's a lot of videos that may help to demonstrate different concepts, or you can again use your ATI resources. ATI is your best friend, and like I said, it is part of your journey. It will stick with you all the way through. You absolutely should use it to as much as you can. Let's talk about some pitfalls to avoid as you're navigating this first semester. Number one is procrastination, and I'm a big, big, big follower of this. I've had to work very hard to get beyond this. Start assignments immediately after they're assigned. Don't wait till the night before they're due, because I can tell you right now, if you email an instructor for an extension because you waited to the last minute to do it, you're probably not going to get a whole lot of sympathy from your instructor. So start the assignments immediately so that you can stay on top of it. And if you run into any pitfalls or run into any roadblocks, you can address them before it's too late. Number two, focus on your growth, not on others' performances. You have no control over how other people are doing in class. You don't live their life and you don't know what kind of resources they have. So don't fall into that trap of this person is doing better than me or worse than me. Focus on what you need to do to become the best nurse you can. Because like I said, you can't control other people's learnings. Make sure that you seek understanding over memorization. I understand the temptation to want to really dig in and memorize so that you can come into that exam and have the information, but I can tell you right now, memorizing probably isn't going to get you where you need to be. Seek to understand, and the best way to understand, honestly, is to explain it to somebody else. Skipping classes is a big pitfall. Attendance correlates very highly and directly with success in school. So I understand when you need to skip class because of a life event or personal problems. However, it does have the risk of directly affecting whether or not you can be successful on the content that's covered during that class. Finally, you need to keep your motivation going. This is the long haul. This is not a sprint. So I have here everyday focus on your purpose. Remember why you do what you do. We don't get burned out because of what we do. We get burned out because we forget why we do it. So even though it's my second point, remember your why. Remember what made you decide to become a nurse in the first place. I remember being in school and thinking, I know I'm going to be a good nurse if I can just get through this. So you have to remember why you're doing it. Remember, progress is greater than perfection. Nurses often have a perfectionistic mindset. It's more a matter of are you improving and are you learning? So you have to kind of break that perfectionistic mindset. Remember, you're not alone. You reach out. You've got a lot of people here to support you and you've got resources. And remember, you didn't come this far to just come this far. You came this far so you can keep going. And remember, you've got this. And finally, as a summary, and I appreciate your time and attention, in closing, remember time management. Your organizational skills will determine your success and your well-being as you move through this semester. Active learning builds lasting knowledge, and remember, your fundamentals course is setting the foundation for the next 3 semesters following and your NCLEX. So it's important to set a strong foundation to build your house on. Remember, you need to have balance, that self-care isn't selfish, it's essential for you and is essential to maintain patient safety. And finally, just an encouragement, you've got this. Every successful nurse once stood exactly where you are now. Every faculty member on this staff was in this spot. So we know that you can do this because we did it. So just keep that in mind. Remember your why, and you will be successful. Thank you so much for taking the time to listen to this presentation. If you have any questions, please feel free to stop by. I'm located in Office 308, and I look forward to seeing you. Thank you.